All right. Hey everybody, Dr. Patel here. Sorry about the delay getting started. Today we are going to be discussing the shoulder and specifically the rotator cuff. So we started a couple weeks ago. Sorry I took last week off. It was my birthday and anniversary and all that kind of stuff. But we started a couple weeks ago with shoulder anatomy and talking about arthritis, wear and tear in the joint. But we can't talk about shoulders and shoulder pain without talking about this thing called the rotator cuff. So if you have shoulder pain, or if you've ever seen a doc because of shoulder pain, I'm sure you have heard of the term rotator cuff. What is it? What does it do? How is it involved with your movement? And how does it get injured? What are the different type of things that occur? That's what we're going to be going over today. Like always, if you have any specific questions about your shoulder or anything else, feel free to comment. If there's something that you want me to talk about in future Facebook Live episodes, then email info@fxregencenter.com. You can DM us or comment, and we will try to incorporate that for future live sessions. But without further ado, we're going to talk about shoulder anatomy and specifically the rotator cuff here. This is my model of the shoulder, and I'm going to use this a little bit through the discussion. I'm just going to expand my screen here so you can see me a little bit clearer. All right, so we're talking about the shoulder. Just to recap some of the anatomy here, this is a right shoulder. The front of the shoulder, back of the shoulder, right side, left side, top, bottom. And this is the collarbone in the front, and this is the shoulder blade that's on the back of our shoulder here, or back of our upper back. Now, on this shoulder blade, you have all of these red things here. And these red things are the muscles that form the rotator cuff. Rotator cuff actually is 4 tendons that wrap around the ball and socket joint. And those tendons come from 4 muscles that start from the shoulder blade. So first of all, what is the ball and socket joint? We went over this last time. This is the ball and socket, like a golf ball sitting on a tee. And the ball is the top of the arm bone, whereas the socket is actually the end of the shoulder blade. And we have the labrum, which is a ring that forms around the ball and socket, kind of like a gasket, holding the ball in place. But we also have the rotator cuff that wraps around the golf ball. So you can see how these tendons all wrap around the golf ball here, and they're almost continuous. In fact, these 3 tendons on the back of the shoulder are pretty much continuous. There's a little bit of a gap here for the biceps tendon that goes to your biceps muscle, but then there's the other part of the rotator cuff, and that is almost all continuous here, just like the cuff of our sleeve, and that's why it's called a rotator cuff. It's called the rotator cuff because these tendon fibers come and attach onto the ball, and when these muscles contract, well, that causes the ball to rotate in one direction or the other, up or down, and that rotation, again, is why it's called the rotator cuff. But ultimately, this is 4 different tendons that are almost continuous, and the tendons are what attach muscle to bone. So these muscles come and attach onto the ball and socket, or the bone, and that is what forms the rotator cuff. Now, this rotator cuff can commonly get irritated or injured in various different fashions. So I'm going to go through what that means, but before I do that, let's talk a little bit more about the function of the rotator cuff. Because even though it says rotator in terms of its name, and even though it does cause some rotation of the ball on the socket, the main purpose of the rotator cuff is ultimately stability of the ball and to allow or facilitate movement of the ball within the socket while we're doing movements of our arm. Now, a lot of these movements are predominantly actually coming from other muscles. We have the deltoid muscles, which are the big muscle on the outside of the shoulder that actually comes from here and wraps around and attaches to the upper arm. We have muscles like our traps that attach on the back of the shoulder blade here and attach all the way down to the upper back and all the way up to the neck. We have a few different muscles that are attached to the shoulder blade itself that are in charge of motion of the shoulder blade. And we have these muscles in the front called the pecs, or our chest muscles, that come and attach at the front of the upper arm as well. And all of these muscles are all involved with bringing your arm up and down, in front of you, rotating out and in, itching your back, putting on your seat belt, putting on your backpack, hooking or unhooking your bra. All of these various different motions of the shoulder come from a variety of different muscles. And the rotator cuff is involved with really a lot of those motions. Now, the main rotator cuff tendon that's involved with kind of reaching up, reaching out, is the supraspinatus muscle and tendon that sits right at the top here. This tendon travels right underneath the tip of the shoulder, which is called the acromion. And it travels in between the acromion and the humeral head, or the ball of the ball and socket. Now, as we get older, in general, there's a little irritation that goes on when we do things repetitively to really all of our body, right? When we do things repetitively with our joints, we start to develop osteoarthritis. When we do things repetitively with our muscles and tendons, we can start to develop what's called tendinopathy or tendinosis, which really does not equal pain. Just like osteoarthritis does not necessarily equal pain, this little kind of wear and tear of the tendons that occurs over time does not necessarily equal pain. And some tendons actually heal very well by themselves. Now, what happens though is that we can be predisposed to aggravating some things like the rotator cuff with certain things that we do. One of the things that can cause irritation to the rotator cuff tendons is actually repetitive use in abnormal posture. I talk about posture, and I've said this before, I talk about posture as much as I can because I have really bad posture, and talking about it makes me sit up a little bit taller. But the reality is all of us, especially when we're on the computers, when we're looking at our cell phones, when we're on our laptops, when we're in front of a TV, in our cars, etc., we have the tendency to kind of round forward like this. Now, this motion here of rounding forward, our head dropping forward, and I'm exaggerating, maybe not for some folks, but I'm exaggerating a little bit here to kind of prove a point. This rounding forward actually inhibits the motion of the shoulder. So what happens is this rounding forward of the ball and socket actually narrows the space between the tip of the shoulder and the ball. That narrowing of the space can put pressure or impingement on the rotator cuff tendon. And because of that pressure onto that tendon is not able to move appropriately, and actually does limit the way that we're able to move our shoulders. In addition, when we're rounded forward like this, our shoulder blade is not in a good position. We're not ergonomically in a good position, and that causes us to have decreased range of motion. So an experiment that you all can do is, if you round forward and stick your chin out and then try to move your arm up, you're going to see that your range of motion for your shoulder is actually very limited. Versus if you tuck your chin back, bring your shoulders back, make a little double chin type of action, and then you can move your shoulder through a full range. Because now the shoulder blade is able to move, the ball is able to move in its socket, the rotator cuff is able to engage appropriately and keep the ball in its socket, and that's why our posture actually plays a big factor. Now, posture in itself, again, poor posture does not in itself necessarily cause issues. However, if you're in that posture and you're doing things repetitively on a computer, reaching, mousing, lifting, etc., then that can cause gradual irritation to the rotator cuff tendons. So what happens is that over time, these tendon fibers start to get a little frayed and start to get a little disorganized. So what does that mean? What does that visually look like? Well, the fibers of a tendon, of any tendon, I said that tendon is what attaches muscle to bone. And those fibers of the tendon, those tendon fibers are actually parallel like the bristles of a paintbrush. If you've seen my previous videos, this will sound familiar to you, but ultimately those bristle fibers are all parallel, compact, and all moving in sync in a nice healthy tendon. But if we're rounding forward and we're pinching off the space for the rotator cuff as we're doing various different motions, then the tendon is going to be constantly irritated as we're doing those motions, and those fibers start to go in different directions. Those bristles of the tendon start to get disorganized. So imagine, take a paintbrush, dip it into paint, leave it overnight. What happens? Those bristles are all kind of matted and crusted and clumped together. That's what's called tendinopathy. Now, that in itself, again, does not necessarily equal pain. However, as that progresses, you can imagine as those clumps of bristles kind of separate, you could picture gaps that form in between those bristles. Well, those gaps are called degenerative or interstitial tears. And again, that does not necessarily equal pain, but when you have that type of situation, and then you go and do something funky, like reaching in your back seat to grab something or wrangle your toddler or whatever it may be, and all of a sudden then some of those bristles can break off, and that is how we develop what's called a partial thickness, or if all the fibers break off, a full thickness tear. Believe it or not, tearing of the tendon does not also necessarily equal pain, and it can be painful, and it could also cause things like weakness, which is something that's more significant and more concerning, but does not necessarily equal pain. In fact, somebody that can have a full thickness tear of their rotator cuff tendon and actually be very, very functional. So we talked about tendinopathy or tendinosis, and we talked about how that could progress in one way, shape, or form to tearing. What is this term tendinitis that you may have heard of, a rotator cuff tendinitis? Well, the little component of that word called itis, right, refers to inflammation. And before the advent of MRI and ultrasound, that's for rotator cuff could actually be more sensitive than MRI, we assumed that this pain that we felt in the shoulder when we have shoulder pain is associated with inflammation. That may or may not actually be the case, and the tendon itself may or may not actually have inflammation. And I would argue that it's more common that there's a mechanical thing that's going on that's irritating a tendon that has tendinopathy and not necessarily inflammation itself. But the word tendinitis is still thrown around, and it may or may not be applicable depending on your pain. Now, what is the term bursitis? Well, the bursa is a fluid-filled sac that surrounds the rotator cuff tendon. So I am going to, I'm going to go back to this image of the rotator cuff that I have here, and I'm actually going to do a little bit of drawing here so you can see what I'm talking about. Now, I mentioned before, let's see here. So this is kind of the ball and socket here. You know, the ball essentially of the bone is right here, and then the socket is right here, right? If you look through the muscle, you can see that the ball and socket is right there. Your rotator cuff tendons are all wrapping around that ball and socket, okay? And these rotator cuff tendons specifically, or the supraspinatus tendon right here, travels right between the ball and the tip of the shoulder, which is called the acromion. So this space that's right here is the subacromial space, and that's the space where the supraspinatus tendon oftentimes gets impinged. Now, if there is impingement going on there, if the tendon is getting irritated, then that's where the fibers can get kind of disorganized, and that's when things like tears can occur within the tendons. And if there's a part of the tendon is torn, then that's called a partial thickness. If the tendon is torn through the thickness of it, then that's called more of a full thickness tear. Okay, but what is the bursa and what is the bursitis that can occur? Well, kind of cushioning the rotator cuff to the various different bones is a fluid-filled sac called a bursa. So we have a bursa that lines the rotator cuff underneath the acromion. We have a bursa that sits underneath this bone where the subscapularis is. We have a bursa in various different areas and essentially acts as a cushion. Has a little bit of fluid inside of it and provides some like a pillow to make sure that the tendon is not just completely aggravated or irritated or torn. So it's a little cushion that sits there that's filled with fluid. Now, if there is constant impingement that's going on here, then over time that bursa over there can get inflamed. And what that means is that bursa fills with fluid, and that is inflammation or irritation of that bursa that fills with fluid, because again the body's trying to protect against that impingement, so that inflammation fills in that. However, when inflammation fills inside of a bursa, that in itself could be painful. So that is called bursitis. Now, the conventional treatment for the bursitis that can occur there is to do a cortisone injection, which would ultimately calm down the inflammation of the bursa. But why did the bursa get filled with fluid in the first place? Why did that inflammation occur in the first place? Well, that has to do with the mechanics of the shoulder, and that has to do with the tendon being irritated, and that has to do potentially with the impingement of that tendon. And that's why doing a cortisone injection can provide temporary relief. But if we don't couple that with the appropriate physical therapy and exercise to get the body moving correctly, well, then the pain just comes back. What's more concerning is if we do a cortisone injection to address the inflammation there, but if we do have some tears inside the tendon, and if the cortisone actually gets inside those tendon tears, well, cortisone can actually make tendon tears worse. Cortisone actually decreases our healing and actually could have a negative effect on the tendon cells. So that's for that reason. Now, there are certain circumstances where something like a cortisone injection may be very, very appropriate, but for all intents and purposes, we try to avoid those if we can, and there are other things that we can do instead of that. So we talked about tendinopathy or tendinosis, we talked about tendinitis, tendon tears, and we talked about bursitis as well. The other couple things that we might have going on in a rotator cuff tendon that's along the line of tendinitis, you may have heard of the term calcific tendinitis, which is when a little calcium deposit or a nugget forms inside the tendon. We still don't know 100% why these form, but one theory is that these calcium deposits ultimately form because the body's trying to heal and is not healing appropriately. So why does that occur? Well, the rotator cuff in this area is actually, I don't know if you believe in God or a higher being or whatnot, but this part of the human body is actually a design flaw that we have, because we have this part of the tendon where we actually have poor blood flow. Coincidentally, the area right underneath this rotator cuff, this part of the rotator cuff right underneath this bone, where the rotator cuff commonly gets impinged, is the area where we have poor blood flow. It's called a watershed region. So what happens is that we have kind of blood vessels on this side, and we have blood vessels on this side, but there's this area in between that we don't have a lot of blood vessels here, and this is called a watershed zone, where poor healing takes place because we have poor blood flow. And that just happens to be where the rotator cuff can get impinged the most. So what happens, we keep on getting impinged there, we have that disorganization of the fibers going on, which is the tendinopathy, and the poor body's trying to heal, but it can't heal in that area because there's not a good blood flow there. And because of that inability to heal appropriately, that's when we can get little deposits of calcium that can form in there. At least that's one of the theories behind calcific tendinopathy or calcific tendinitis. And other things that can reduce our ability to heal can predispose to calcific tendinitis, things like diabetes, which can affect our blood flow to the small little blood vessels, right? So there are things that can predispose to us having those calcium deposits form. Now, when those calcium deposits form, they don't necessarily actually have to be painful. If those calcium deposits are big enough, like if those nuggets are big enough, that wasn't a good color to use, right? If those nuggets are big enough and they're actually occupying space, then that can certainly further the tendinopathy or tendon tears in that area. That can certainly cause inflammation or irritation. Interestingly, while those calcium nuggets are actually resorbing, or if they're actually going away or resorbing back into the body, that actually can cause inflammation and can cause a significant amount of pain. So I think that's the majority, or at least the most common things that can occur with the rotator cuff. And ultimately, there are a lot of different treatments that can be beneficial for the variety of different things that go on. Really comes down to matching the right treatment for the condition. Is it an impingement of the rotator cuff? Is it tendinopathy or tendinitis? Is it bursitis? Is it tearing of the tendon? And how do we deal with not only that actual specific pain generator, but why is it happening in the first place? So one of the most common things that I recommend for patients that have rotator cuff issues is proper guided exercise through physical therapy. Strengthening the muscles of the shoulder blade, of the traps, the rhomboids, the various rotator cuff muscles, the lats to bring that ball and socket into an appropriate position. Avoiding certain exercises like your overhead press and your other deltoid exercises like flies and things that are going to strengthen the deltoid but ultimately potentially cause some further impingement of the rotator cuff. Getting the body moving correctly ends up being the most fundamental part of treating rotator cuff pathology. Now, I mentioned cortisone injections, which could potentially be beneficial for very specific situations. Typically, what I use is a patient's own blood growth factors, or PRP, platelet-rich plasma, to treat the underlying tendon issue or calm down the negative environment in that shoulder. But oftentimes, even if the rotator cuff is the main issue, we may also want to address the joint itself to improve the stability of the joint using a patient's own orthobiologics. But without the exercise, the physical therapy, getting the body moving correctly, without fixing posture, without ergonomics, any interventional treatment won't be successful. So I think that is the fundamental thing that is so important. And of course, you can't heal appropriately if your insides are not allowing you to heal. So when you're going through an injury and healing process, the proper nutrition, the avoiding things like processed sugars and controlling your diabetes if you have that, those are all important factors to allowing your body to heal appropriately. Sometimes surgery is absolutely necessary. It actually can be very necessary if you have a full thickness tear of the rotator cuff and those tendon fibers are significantly retracted or pulled away from each other, then a surgery may actually be the right thing to do. Just this week I told a patient that they needed to go through surgery first because there was nothing that I can do conservatively to actually stretch those fibers back together and heal them. But the reality is that if we have a significant tearing, more often than not, that is in the setting of tendinopathy or unhealthy tendons. So just sewing those tendon fibers together may lead to a re-tear if we don't correct some of the other issues. So again, the mechanics, the exercise ends up being key. And sometimes using a surgery in combination with a patient's own biologics, whether it's blood PRP or bone marrow cell therapy, can actually help with strengthening those fibers that are connected together surgically. As you can tell, there's a lot of different treatment options, and there are a lot of different things that can go on with the rotator cuff. Really comes down to matching the right treatment to the right condition. So if you do have shoulder pain, and if you were told that you had bursitis or tendinopathy, but if your physician or your clinician that was evaluating you didn't take you through a full, thorough physical examination, or didn't do something like a diagnostic ultrasound to see what's going on with the rotator cuff, then I implore you to be your own advocate. See somebody that can be more thorough to really figure out what is going on, because that ultimately will guide towards the best possible treatment for you. Hope you guys enjoyed today's talk. We're going to continue on talking about shoulder. Next time we're going to try to do something new, which is I'm going to do a shoulder physical examination live on Facebook. So get ready. I'll get you seeing what the rotator cuff and the shoulder joint can do, and what a shoulder exam looks like. And then we're gonna go from there. The following week I'm gonna try to do a live ultrasound of the shoulder so you can see your anatomy, and we'll talk more about that as the weeks go on. If there's something that you want me to talk about, please reach out. Again, email us at info@fxregencenter.com, DM us, or you can comment on today's show. If you liked today's show, found this informative, please like it, share it, and looking forward to seeing you guys next week. Have a good weekend.